We're on, brother.
Aloha, Charlie. Hello, everybody. Welcome to a Facebook Live with Mel and Charlie. Appreciate you guys being with us tonight. How you doing, bro?
I am doing fine. I'm doing fine. How's everything going with you?
Going well? Not a
Well,
long day at work. Not a long day at work.
I guess the numbers aren't doing so fine.
Oh, yeah. 109 cases today. A bunch of those were kids.
Yeah.
And the other news that we see popping up now on the headlines about the First Hawaiian Bank employee testing positive. Another fire department, Honolulu Fire Department. Costco, we know about the two locations of Costco. And one that just popped up about 15 or 20 minutes ago, Arcadia Nursing Home, one of their dining services employees tested positive. I predicted 100 cases by this past Sunday. I was off by a few days, but I
Damn
honestly
close.
believe,
You're damn close. You're damn close.
it's just looking at the numbers and the trends and using the average 2.8 people infections per person. We're actually, I'm thinking by the end of the week, we should be very close to 200.
Mm-hmm.
But this is what we're expected. Oh man, I forgot to, hang on, Charles. I forgot to do the
Yeah.
that was expected. And I don't want to scare nobody, but I definitely want to state the facts, and the numbers don't lie. And I know there's still people out there that are concerned about shutting down and all of that. But I think this can get away from us very quickly. From where we are today, it can get. Dr. Anderson is concerned. Dr. Lieutenant Governor Josh Green is concerned. Obviously, Dr. Miskovich, and tomorrow we'll have Dr. Dr. Tripkovsky from Doctors of Waikiki. They're all concerned because we saw this happen in other states. You get the ones and the twos, then you get the 15s and the 17s, then you get the 60s and the 70s, then you get the hundreds, and then from here, the exponential growth can be very damaging. So we got to get a handle on this. And I know that the governor, in his press conference today, is working diligently and working with the mayors. We'll have our mayor, by the way, on our show on Friday night. I spoke to him today. He's excited. He asked me, what do you want to talk about? I said, this is your show, Mayor. Use the hour however you want to use the hour. And he was very, very happy about that. And I know that he will be talking about schools. That's what we'll be talking about tonight with the some healthcare providers, some educators, and they should be coming out in about 10 minutes. And I think we're going to have a lively discussion. But back to the numbers, we knew, we were hoping that this wouldn't happen, but we knew it would. And I'm very concerned going forward how these numbers are going to jump. And the governor and the mayors at some point they're going to have to make some tough decisions.
Well, what concerns me is when these numbers pop up, right? I still don't know if these numbers were from a testing, like a drive-through testing, right? I don't know if it's from that. Normally, I would associate testing when somebody goes to the hospital, gets sick. That's what sounds the alarm, and you start moving from there. But I don't know if it was one of those drive-through testing where a batch came up, go, find out where these people are from, that led to the bars, da 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 da. You know what I mean? So,
Mhm.
so that's what concerns me. It's how because um, it's on someone's radar. It picked up, and so I guess they see a bunch. So if we're talking about a cluster in a bar, we're talking about 12, if I'm not mistaken, the way they were talking today, right? That's in a bar. Okay. What about the other 88? Where are they? I mean, they could be someplace that's, is it multiple pockets? And how far how's that net stretch out? Because you're gonna have to get a bigger net for try to haul all of that numbers back in. Who knows?
Thanks, Francine. Francine just posted shared. If you guys please share this now, start a watch party. I know we'll have a lot of people on tonight because this group of concerned professionals they stretch statewide, and so I expect a lot of people watching tonight. So yes, please, if you can, hit the share button, start a watch party, do what you want, but make sure we get this out as to as many people as we can. We're going to be talking about the health and safety of our kids, our teachers, our employees of the schools. And as like we were talking about last night, Charlie, we don't know what these people are going to say. We have no idea. I'm excited though. I really am, because it's a critical. We're at a critical point right now. We know that the superintendent of Department of Education has recommended to the Board of Education that we extend the opening of schools till for 2 weeks. Then the numbers came out. Today's numbers came out. So the numbers are different, and so we're gonna see if what changes. We're gonna see what the numbers are tomorrow. You know, one of the concerns, I know a lot of people are keep asking whenever I post, they say, you know, how many hospitalizations, how many deaths? First of all, Dr. Josh Green, Lieutenant Governor Green, is very concerned about the hospitalizations. He said it on numerous occasions that if we don't get a handle of this, we are going to run out of resources. As far as the death count, I don't understand the question. I mean, how many deaths will it take? We're trying to prevent deaths from happening. And so, I mean, we talked about that already. I mean, a lot of the new cases were throughout the country. More younger people are being affected. More younger people are contracting this virus. The younger people are able to survive, but it doesn't mean that they're surviving without any type of complication. So, you know, as far as I don't use the death rate for my own assumptions. I don't use the death rate as a trigger of what we do next. No, completely the opposite. We use the numbers, for me, the numbers of positive cases that can in fact infect other people that are very vulnerable. That's the reality. See, we don't want to pass this virus on to people that are vulnerable, that cannot survive. So the death rate, I understand. Yeah, we have a very low death rate, but we want to keep it that way. We don't want, you know, 1 death, 2 deaths. What is it going to take before we start shutting down? We don't want that to happen. The percentage of positives, I don't know if you saw that today, Charlie, 6%. Based on today's testing, when the original numbers came out, they miscalculated the numbers. They came out with a 2%, but the Department of Health clarified that and said, based on the test that they did to produce the 109 positives, it was a 6% positive rate. Now, that is very alarming. 4% was bad enough. Now we're at 6% because more and more people are testing positive based on the numbers of tests that we give. So the numbers aren't good, and I think we need to acknowledge that. And you know, if you want to go and pick using the death rate, mortality rate, then we're behind, and we're gonna see more people getting sick.
You know, I guess when somebody picks a death rate, it causes me to think this way, and that is, they're gonna use a death rate, and you know, when the death rate gets to a certain number, that's when it'll shake some trees, right? It's almost like when people getting ready for a hurricane. You know, while it's maybe at the beginning around the Big Island, we on Kauai, some of us just really don't do nothing until the thing get to Oahu. Then that's when we will start doing something. So, you know, for me personally, I've been sounding this horn, and you know, it's just like it's been falling on deaf ears. So maybe nobody wants to hear it. So I've stopped trying to preach it, because only from one aspect, and that aspect is this: either I'm thinking of going about this the wrong way, or I'm trying to assimilate what's happening in a wrong way. But my thinking, and you know, Mel, we've talked about this before, this cop mentality of ours. We love to we love to do puzzles, man. We just love to watch how certain things fall into place. And for once, you're hoping that what we're thinking about doesn't fall into place, because if it does, that's very alarming, like you said. And unfortunately, the numbers we talked about before are now falling into place. So I just was reading the John Hopkins medical from John Hopkins University about this ongoing study they've done starting began, I believe, back in March, and they have different studies, a multitude of it. One of it is uh, they're tracking recovery of COVID and what medical disabilities are associated. And one of the biggest one right now is the heart. It's cardiac. They're looking at that with great, and you know, if one common theme they always talk about is inflammation within the heart walls, inflammation due to COVID. I mean, it's over and over again. So today, I you know, while we were stopped, I was reading this thing, and I was just like, I was getting enthralled in this whole thing. And it's, you know, for a layperson, it can be rather scary. So, you know, I'm not a doctor, but I can read the darn thing, and it's not nice. It's not nice at all.
Well, again, we talked about it last night. Kauai's viral load is low, and if we can isolate our island through an inter-island quarantine, we can go about our regular business. We don't have to shut the island down if we can make sure that we quarantine our people coming in, inter-island or mainland. It doesn't matter, and making sure that these people actually comply with the quarantine rule. Then our local economy can flourish.
Yeah.
We really can. And uh, I'm just looking, a new KHON2 pops up. Every time a new headline comes out, it pops up on my phone. And it was a COVID survivor that said, "You're faced with your own mortality." That's what a COVID patient is saying. You're faced with your own mortality. In other words, you control your destiny, and you can go around and play with this thing and pretend that it's not dangerous. And you basically dictate your future, your health future. So
Hmm.
anyway, we really gotta again, how much more can you say about individual responsibility? How much more can you pound into people's heads? Wear your mask. I spoke to a woman tonight who called me. She had a question about TVR. She's on tonight,
Hmm.
and she said she just went to Maui, to Hana, and the number of people without masks, the number of people on Maui that are walking around and congregating without masks is insane, and it's happening on every island. And because our viral load is low, maybe we're not seeing the cases like Honolulu. But why would we want to get there? Why would we want to even head down that path? So again, um, it's up to us. It really is. It really is. It's up to us individually and as a community to do what we need to do to make sure Ireland is safe. I did post up, Charlie. We'll bring them in because it's almost time. But I did post on my wall today on my feed about, we've been getting a lot of legal questions, a lot of questions about what can I do regarding unemployment, school. Um, my boss wants me to come to work, and I don't think it's safe. All of those questions, and we put together a free resource page. It's from a company that I work with, Legal Shield. It's not a sales page. It's a free resource page, freecovidresources.com. Um, you can go there and click for your family, your business, and all your questions that you can possibly think of is there. It's updated regularly. When the legislation changes, it's updated, and it's free. And please stop there. And go check it out. Again, freecovidresources.com. Go check it out. And if
We
you have
we
any free,
we have a person, Cara Flores. She will be sitting in for. We had one of the guests who has unfortunately can't make it. Mel Eisenhart. She's a parent and Maui mask makers leader, and she will not be making it tonight. So in her place will be a Cara Flores. So if you see Cara Flores,
yep,
on
she's in here.
your
I'm going to
screen,
be bringing them in right now after I type in this link. COVID.
anyway, folks, um, we'll try to get to your questions tonight as they come about. We're going to let them talk because apparently they've been spearheading a lot. I've never heard of this group before, but it was recommended to us by a good friend of ours who watches our show, follows us regularly, and asked me to reach out to this group, which we did. And thanks to Dana Moore, she was able to assemble this panelists for tonight. And these are very, very concerned individuals, and we're gonna have them on tonight.
All right.
Yeah.
So I brought them all in at the same time because I just thought that would be pretty cool. We have Cara Flores. We have I'm gonna let you guys introduce yourselves because I think I forgot. I think this is Stephanie Lan. Was that Dr. Lan?
Stephanie Yan.
Yan.
Okay. And Dr. Ignacio. All right. And of course, Cara. We just were informed that Cara is filling in for
Mel.
Melissa. Mel. Yeah.
Okay.
And I'm Mel. And
I'm
that Hawaiian is Charlie.
Aloha. We have a dog in the background, I see.
And there's Mirelle Ellsworth.
Yes.
We are very excited. Somebody asked me today, Mel, why only women? Well, why not only women?
Right.
Really, honestly, when we schedule our shows, we don't have a sexual preference. It's whoever can provide the information, we bring them on. We don't even think about anything other than value. So I don't know why it happened to be all women. It could have been all guys.
Your equal opportunity.
Absolutely. And then somebody else came on and said, well, it's because they're all better looking than you, Mel. Well, that's true. But that's also not why we bring people on. Gosh. Anyway, I know we're expecting 6 of you. We got 4 of you so far. But why don't we start with, and I don't know if we'll all show up in the same order on our screens, but let's just start with Stephanie, because I'm going to just go down the list on how it looks on my screen. So Stephanie, if you could just introduce yourself real quick to the millions of viewers that are watching.
So my name is Stephanie Yan, and I'm a general trauma and critical care surgeon. I did my general surgery training at the University of Riverside in Southern California, and I did my critical care training at the UH in Oahu. And I am here in Maui. I have a general surgery private practice, and I also take trauma and acute care call at the hospital. And I've been involved with the Hawaii health provider COVID group since the beginning, since in March. And we met every day for about 3 months to kind of discuss resources, issues in the community, and it was our go-to community support group, as well as the bridging of all the resources in the community that we can gather. And I've also been involved with PPE procurement for our independent physicians and dentists and healthcare providers, and as well as our contact tracing application that we're developing that's community driven, and then helping with procuring testing that's not limited by reagents and also affordable in the community. And I'm working with a contact tracing app with a coalition in Hawaii, as well as with Elizabeth and Ignacio, who's here. And she's also spearheading the testing committee, who's trying to bring in all different testing types so that we're not competing with other places on the mainland for testing kits and testing equipment.
Awesome. Thank you, doctor. Thank you very much. Next up is Cara Flores.
Hi, I'm Cara.
Cara, you need to unmute.
Oh, let me see.
Uh-oh.
Let me try it with my headset. Can you hear me?
Yes.
Yeah, now we can hear you now.
Okay. So I'm Cara Flores. I'm substituting for Mel. Mel was running the cloth face mask initiative here, and she got a lot of volunteers along with some other people to sew face masks when we were low on PPE. And then I run the Hale Hawaii group, and our mission is to get Hawaii COVID-19 free. We feel like the only realistic solution and plan forward is to stop community spread, because this is so contagious and we don't know what it's going to do. And because we have been running polls with the local residents, and what we found is most people want that plan. So we're just really pushing for the governor and, you know, elected officials to, instead of trying to keep our cases low, to change that priority to stopping it, like stop community spread, because we have thousands of miles of ocean around us. We're the only state with that advantage, and that really makes us unique and special. It gives us an opportunity to live and have no COVID in our daily lives. And I'm also a mom of 3, and so I look at my kids and think, if we have community spread, they might not go to school. They might not be able, my daughter does drama and singing and dance. She may not be able to do any of that. My son won't be able to play baseball. You know, my oldest son is on the spectrum and he won't be able to have like the social skills he needs, even though he doesn't necessarily want it. So just as a mom too, you know, there's a lot of value in our kids having a good childhood and a more normal school environment, which is only possible without community spread, you know, going around. So that's what we're working on.
Thank you, Kara. Dr. Ignacio.
Sorry, I just had myself muted for a second. I have dogs and kids, and they're just being a little chatty right now, so I apologize. But thank you so much for having us. I'm Lisa Ignacio, and I'm a physician here on Maui, along with Stephanie. And yes, I've been working with High COVID. They've done a lot of stuff to try to, you know, pool resources, knowledge, strategize, do everything we can to just try and deal with this pandemic. And you know, I'm excited to work with all these people are very, very invested, right, in our group, in our community, and particularly in the neighbor islands where sometimes we don't get all the same kind of resources that they have like centrally over in Honolulu. So, you know, we try to advocate, yeah, and get as much as we can over here. A lot of stuff that we've had to sort of pull on our local folks, you know, for our PPE, for, you know, securing supply chains, for finding the resources to protect our teachers. So that's one of the reasons that keeps me coming to all of these things, so that we can do what we can for our neighbor islands. Oh, and I'm with the Hawaii Medical Association as well as working with High COVID. And so I'm involved in a lot of those advocacy efforts with our county and state leaders when we can get them.
Okay. Thank you. And is that Mirelle Ellsworth?
It's actually a French name. It's Mireille.
Mireille.
Of course, I butcher it because I'm American. It's probably Mireille, you know, it's more French. But my mother liked the weird name. Yes, so I'm a teacher at Waikea High School in Hilo, and I've been so for the past 17 years. I teach English, speech and debate, and acting. Kara, your daughter, I'd love to have her in my class. Yeah, I previously worked in Guam and lived there for 17 years. I'm a public education activist with the Badass Teachers Association when the Common Core came out and all the standardized testing was being shoved down children's throats. And it got me all up in arms. And so I just found the Badass Teachers Association on Facebook, and we started doing work, you know, meeting almost yearly in the mainland, usually in Washington, DC, and doing all kinds of actions. So when all of this came out, I mean, all summer I've been planning to how am I going to teach these courses online, because I thought that was going to be the logical choice, start online. But when I found out there was going to be no option for teachers to teach online, and we had to teach face-to-face and be exposed to more than 100 kids a day in our secondary schools, I was appalled. And I just said, that's it. I've got to make a plan. So I made a plan for myself, and it could involve leaving the island and leaving the profession. I had to be willing to do that because there's a lot of toxicity in the school systems. And I wouldn't say my principal is that way, but I would just say that in general, you have some retaliation that happens and teachers are very fearful to speak out and be whistleblowers. So I just felt like I had to be ready to lose my job in order to do this activist work. So I said, I have the skills. It would be unethical for me not to use them.
Wow. Am I muted? No, I'm not muted. All right. Awesome. Welcome all, ladies. Welcome all. I'm not sure where the other two are, but that's okay. We'll get started.
7-Eleven. They're at 7-Eleven.
Is it 7-Eleven right now?
No, they're at 7-Eleven picking up
They're-
a Slurpee before they come on.
Now, let me apologize to all of you before we start. That's Charlie. He's the comedian of the group. And this is a very informal meeting, or whatever you want to call it. And it's not censored, it's not edited. So we just speak from the heart here. So feel free to say whatever you guys want to say. Now, I guess the big question for all of us is returning to schools, the reopening of schools. And I'm not sure how we want to divvy this up. I'm thankful that we have doctors as well as educators and activists and people, community people. So I'm not sure who wants to go first, but what should we be doing as far as schools? I want to, before we start, I just got this message that I want to read because this is coming from a school teacher and just came in. It says, today was my first day back to school. Today and tomorrow are admin days. This is my 28th year of teaching, and this will be a year to remember. What I did want to share is that I spent over an hour trying to reconfigure the way I set up the desks for my students. Myself and another teacher shifted tables and chairs using a measuring tape, making sure my students are 6 feet apart. Not an easy task. There is not enough open storage on campus for extra furniture, so classrooms are tight. We are all doing our very best. That's from a teacher, 28-year veteran, good friend of mine. And I can only imagine the frustration for these teachers who are tasked now with creating this safe environment where it's almost, in some cases, in many cases, is not possible. So who wants to go first?
I think it's always best to have the main stakeholders kind of state what their concerns and what their challenges are, and then the healthcare providers, which is the doctors in this group, can kind of chime in and validate some of their concerns and also give a little bit of citation of resources and literature. So I think it's always good to start from that standpoint to hear from people who are very much affected by it. So I'd like to start with the teachers, if you all don't mind.
We don't mind.
Maria, did you want me to put up the slides, or what would you like to do? So we did have some visuals just to prompt some discussion. And when we had sort of powwowed beforehand, because we wanted to, sort of make sure that everybody had the opportunity to speak. But I agree with Stephanie that, the spotlight here is on our teachers. So whichever way you'd like to do it, Maria, I can put up slides for you. I have the ones that you wanted to discuss.
Well, I would just like to start with the first thing that alarmed so many people, but it was not widely shared. And this was a video made by the Department of Health to advise administrators as to how they can go back to school safely. Featured Dr. Park, and it promoted this idea of Ohana bubbles. And it was about a 45-minute video, and it shocked me to no end. And it shocked the parent who started the group, the Facebook group that's become now the activist hub for this cause. And the video depicted things like kids of maybe first or second grade sitting in a circle or laying on a floor on their stomachs in a circle facing each other with books, with no masks. It must have been stock footage before COVID. And they just said, so when you're in your classroom, you can take off your mask and be relaxed because you're in your bubble. And if somebody comes into the classroom, they're not part of your bubble, so they need to be wearing a mask. And when parents come to pick up their kids, they need to be wearing a mask because they're not part of the Ohana bubble. But it was just absolutely ludicrous to us because these kids go home, they're not wearing a mask in their home, and they're going back and forth. And that's just elementary. For secondary, the kids are changing classes. They are exposed to not only their friends in the hallway, but their teachers and all of the students in those classes. I mean, we even had a parent come up with the idea of, 6 degrees of COVID bacon, if that would make some sense, of how a community spread actually happens. There's just been so little community education, we feel, in Hawaii as well. Parents are ill-informed, and even with the educational choices that were being offered, parents were just not being given any information. So we started this Facebook group on July 12th. And it was actually started by a parent, and I just got invited somehow through my networks. So throughout the discussion, first it was just like a rant. People were just appalled. Some were actually just trying to figure out how to make their classrooms safe. It was just a mixture of all kinds of things. And then we said, we've got to do something else. So we called 2 town halls on July 19th and 20th. They were well attended, and the first one was the state union leaders were there, of the union, for the teachers. And they didn't talk much because, they have to be careful. They have a board, they have to pass things through for vetting, but they listened. And boy, did they listen, because the very next day they called their board meeting, and then they started releasing the whole concept of we have to delay. And so we feel like we were the impetus or the catalyst to make that push to start. So throughout everything, we said we've got to consolidate all of these ideas somehow because we got to be solution oriented. So Lisa, if you don't mind, Dr. Ignacio, if you don't mind putting up that slide, we have a 4-phase plan, and this was just based literally on the conversations on the Facebook page.
Can I share screen? Yeah.
Yes.
Yep, you should be able to share the screen.
Let me get to that slide, which is this one here. And there we go.
So I know it might be a little small. If you're on a phone, you could probably expand it, or if you have one of those touch screens, those are awesome because you can blow it up a little bit more. But basically our plan is showing that DOE, they were trying to skip what we're calling phase 1 and phase 2. They were trying to just do the regular 4 days before school. We have 2 days for teachers to get their classrooms ready and 2 days for all the videos we have to watch about bloodborne pathogens and, all the logistics we have to do. Those are just the normal 4 days we have to do every year. And then they were going to go straight into what is depicted here as phase 3, hybrid or full face-to-face for some elementary schools. Primarily those elementary schools who decided to do full-on face-to-face, most of them are in Oahu, which is the highest numbers, which is scary. But anyway, if you look at the plan that we're coming up with, we think that there should just be extensive training at the very beginning, and this cannot be rushed. This is going to have to be well informed. And after what Department of Health came out with, we don't even feel we don't trust DOH after coming out with that thing that is pretty much propaganda. So we're like, we don't even know who we should look to do good training. I mean, that Ohana bubble thing was basically very reactive in nature, because Bruce Anderson even came out and said, it's okay, we can open schools because it's so easy to contact trace. That is very reactive, not preventative. I mean, they're operating on the principle that kids can't spread it. And we know that New York Times published, I don't know, a week or two ago, a story about a study done in South Korea with 30,000 subjects, I believe. And they said kids 10 and up can spread it. And of course, the younger kids are a little inconclusive at this point. And I would love to get some verification on that from our medical professionals, because I'm an educator. I'm not a medical professional. The 4-phase plan, the training, again, we really need the subs to be trained. And we also have people coming from the outside, like support personnel. from nonprofit organizations to help like our autistic kids. They call them skills trainers. They're not even part of the DOE, so we don't know how they're going to be trained, because if the kids come, they're going to need to be there too with the kids. So we also feel that subs need to be compensated for this training. We also think subs should have healthcare, you know, but that seems like it's a big ask. And we're basically also being told, and we've been told through the summer, that they're really looking at a 20 to 40% pay cut for all of us teachers too. So I don't know what the plan is there, but I have a feeling they're just going to spring it on us when we're all ready to go. Who knows? So moving on to phase 2 is the online options. And I have another slide that Lisa is going to show you guys, because there's so much confusion about this. So I don't think parents were educated about what a distance learning option might be. There's so many terminologies out there, and really homeschool is going to take funding away from schools, because you're basically withdrawing your child from the system. And so there's no per pupil funding for that child once that happens. Plus you won't get any resources from the school. So homeschool is like, you are just avoiding truancy laws and saying, okay, I am going to be responsible for educating my child, but there will be no support. Distance learning, what they've been offering up till now is, and not all schools even said that there was a distance learning option, but in the MOU, the Memorandum of Understanding between HSTA and the Teachers Union, we stated that we felt every child deserved to have an option to learn from home. But what they came up with was not pairing them with a real teacher, but giving them some sort of robo program. I call it robo program. Acellus is one example. Plato is another example. And these programs are really designed for supplementary learning, not necessarily to replace teachers. We feel that every kid deserves a real teacher. And so that would be virtual learning. And virtual learning doesn't necessarily mean that the teacher is teaching live like we are right now. It could be a recording, which is helpful too, because the kids can review it. So that's what the synchronous is. Synchronous is like what we're doing now. We're live, we can talk, interact. Asynchronous is just recorded so that the kids can review it independently. So I just wanted to make sure that was straight, because our schools are already starved of funding. So to pull them out in a homeschool situation, not only is it a disadvantage to the parents without getting resources to at least get some sort of help, but it's also starving our schools even further. I want to stop first before I talk too much and just ask if there's any kind of questions that are coming up first.
So I'd like to address a little bit about where the whole idea of Ohana bubble, I think this is how I'm thinking about it. They are adopting a concept that's been tried in different places about pods. People in schools, mostly younger ages, staying in the same class with the same teacher. Now, most teachers know that during lunchtime, the pod doesn't really work. And especially in the higher grades where they go from different teachers to different teachers. But when these pods are talked about in different case studies, they're actually talking about communities that have good community control. That means low prevalence in the community, and there's been government and state and city efforts to mitigate, to really strongly mitigate the spread of the disease in the community, such as, stay-at-home orders, or having a very effective quarantine plan of any travelers coming into the area. So the city and the governments that these pods have been looked at takes into consideration very low spread of the disease, very low prevalence of the disease, and there's identifiable markers where the city or the government have seen success in their mitigation efforts in the community. So it starts school safety, school reopening safety starts with community safety and controlling the spread in the community. That means having good PPE for all the essential workers, healthcare workers, and teachers as well. having good, available, affordable testing options. Right now, there's a current surge in different areas of the mainland, and it's affecting our turnaround times for our tests. And we're expecting that to go up as reagents and testing kits supplies will go down. We already know that the DLS a couple of weeks ago reported that they've cut in half the tests that they're offering. We just heard recently that they're going to stratify which tests are going to be run on island, which test is going to go to Oahu, and which tests are going to go to mainland. So that means the turnaround time for these tests are going to take longer. And the communities that these pods that have been studied in these case studies by the American Academy of Pediatrics and other academies and societies that have put up safe reopening plans actually had good testing in the community. So we haven't secured that supply for our community. And then on top of that, their contact tracing is up to par. They're using technology, they're using people in the community, they've trained everybody. So, and then on top of that, they also have a viable quarantine plan. A lot of these places are quarantining essential workers who are traveling, tourists who are, or residents who are coming back. They're not allowing tourists yet. A lot of these communities are not allowing tourists to come in. They're quarantining their essential workers. They're quarantining residents who are coming back in specific hotels, in isolated areas where they're not able to spread this stuff in the communities. So there's an underlying conditions for these pods to work. And they were specific to younger age who stays in one group. And so the teachers are trying to express that the practicality of this in the classroom, in the school, is not possible. This bubble can easily pop because we don't have the community prevalence taken care of. We don't have the community mitigation measures up to par to the communities that the pods have worked in these case studies pointed out by these different guidelines, or the people that have put out the different guidelines. And another thing I want to address is Ms. Ellsworth talked about the studies. There was a paper on JAMA. It was published July 29, 2020, about the transmission of kids in school. And that study was very weak because its conclusion was that kids younger than 10 have very low transmission rate to people in the community. Now, if you look closely, the communities they studied had other mitigation measure. It was during the time where there was a lot of stay at home, shelter in place. People weren't going anywhere. So, and then the community prevalence, you can't really say the frequency of transmission is from this group to this group is low if you don't know the community prevalence. And in these studies, in these communities they studied, at that time, we had no background prevalence because we weren't even testing that much. So to assume the transmission is low because that's the calculation their math showed without community prevalence in consideration is a very big weakness to the study. And it's also the confounding factors of not having or having the stay-at-home orders at those times and having strong mitigation, and people were still kind of, yes, let's stay at home, and now we're kind of weakening and we're kind of laxing a little bit. Those conditions are not met, and we're seeing in Florida, we're seeing in the high surge areas that kids are getting infected and they are spreading it, but that study has those weaknesses. So we can call into question kids' transmission to the community and teachers still because the data is not out. And that study from July 29, 2020 in JAMA, who says kids younger than 10 have low transmission, it was very inadequate. It had a lot of confounding factors to it that wasn't taken into consideration. And then what else was talked about? The 4-phase plan that they're presenting, and I think you didn't finish with the 4th phase, so we can go back to that. It's a smart plan because it gives what we have to do is to strategize, right? Because I want to put out that idea that a lot of people in Hawaii are saying that we have low prevalence here. Why are you making it a big deal? Let's open schools because one, kids can go to school. There's babysitters, there's pseudo babysitters for families that want to work. There's social programs that are offered at school. Abuse can be detected at school. All those positive effects of the school are there. And I said, yes, but you got to understand, I didn't have a lot in college, right? So this is just my analogy of it. I worked as a waitress and my parents paid for tuition. I paid for everything else. My margin of error during that time was very little because I had low resources. You have to think of Hawaii as a low resource place because we don't have 10 hospitals per metropolitan area. We have very little margin of error. So to compare our community prevalence rate to other people and say we have low prevalence, we could be lax, we can open up, we could do all this stuff, is not taking into consideration the local factors. And it's differing too. In Honolulu, they have more hospital, right? But they have more population. In Hana, it's great the mayor closed it for a long time because their margin of error is very little. Their risk, the amount they can take a risk is not much. Molokai is the same way, Lanai is the same way. So when you say low prevalence, it has context, right? What is your community resources? And if you identify yourself as a healthcare poor resource place, which we are, if you identify your place as having a high, 18% of our population is elderly, if you identify your place as having many people who are in multi-generational household who depend on each other for babysitting and for family function, you have many people that will be exposed with the reopening of school, even though we are low prevalence compared to other places. So I just want people to have the idea of having a margin of error that's very narrow compared to other places in the United States or the world who have social services, who have healthcare.
Thank you, Doc. I mean, you said that so well, so eloquently. I think many of us, we understand we are not the mainland. We are not Florida. We are not anywhere else. And we're a different place. And I think you're right. A lot of the jury's still out on a lot of things. It's a new virus. We're still learning every single day. And, we've heard that from so many medical professionals that we've had on the show. Before we go on, I wanted to introduce Dr. Sonia Gupta from Maui as well, another founding member of your great coalition. Sonia, are you there?
Yes, aloha, aloha. Thank you.
Aloha. Are you the ones that don't want to put your video on or your camera?
Oh, you know what? I have my camera, but I have my little one here, so.
Oh, there you go.
Not sure if it's working.
Yeah,
he always keeps in with me. Okay.
We had one guest who just refused to turn on her camera.
Okay, baby. Okay, sorry, anyway. I think we have to go camera off again, but I'm here.
Well,
Dr. Gupta, why don't you go ahead and introduce yourself so everybody knows who you are?
Oh, sure. I'm Sonia Gupta. I'm a dentist on Maui. I do hospital dentistry at Maui Memorial, and I've worked at all the hospitals on almost all the islands. And I was asked to be here as an advocate of the temporary smoking ban in excuse me, multi-unit housing complexes, because a lot of our keiki excuse me, and our kapuna are getting exposed to secondhand smoke from everybody working at home right now. Sorry, my little one is muted me here, so yeah, I'm here though.
Perfect. All right. I see the slide up, American Academy of Pediatrics. I'm not sure if someone wanted to go over that.
I just, Yes, and I put up some of these slides just to spark some conversation. I appreciate that we're going to keep it casual and open, and I wanted to hear from our audience also what their commentary is on this. You know, I just wanted to also address some of the confusion in the media about what is the best way forward, and there is no good answer. You know, when the American Academy of Pediatrics was looking at this problem, they were looking at it really from the perspective of, you know, the children, which is appropriate. And they were thinking, you know, we've got to get kids back in school because of all the, you know, the social implications for them. They're losing ground on their education, but as well as their social development. And so, you know, that's what the position of a lot of the pediatricians that I spoke to were, as well as the American Academy of Pediatrics. However, if you looked in the media, then they kind of walked back on their position, understanding that, you know, we have to be very careful and remember that our teachers are also essential and first line, you know, folks who are going to put themselves in harm's way when they are taking care of our keiki. And this is a nice article from NPR that kind of sums up how we will, you know, we need more time, we need more funding, and we really have to look at our teachers as an important resource, especially, you know, here in Hawaii, we're very shorthanded with our teachers as well. There's a shortage, and then to lose some of them because they can't participate because they have their own health risks, to lose some of them to illness because some of them will get exposed and will get sick. You're already going to lose a substantial number of those teachers, and we need to develop more funds, resources, and time. Can't rush it. Just like Maria said, you cannot rush it, so that they can prepare and we can open the schools appropriately. So, you know, when you look at the media, and at first it was like there were a lot of pediatricians, and I follow this because I'm a mommy. You know, I have children that are going to go to school, and I wanted to know, geez, what is the best way to do this? And American Academy of Pediatrics, yay, you know, they think it's okay to go to school. Okay, well, maybe it's all right. But then, you know, didn't really think about our teachers. You know, I'm guilty of it myself. I was thinking of it more from the perspective of medicine, but, you know, when you think about the epidemiological implications of how, like Stephanie said, do we have resources and are we prepared at baseline to move forward and reopen? And then also thinking of our teachers front line, you know, front and center, we really need to take more time. So I'm glad that there's that consideration. At first, when we were powwowing about this, we were thinking August 4th, and now we get to say August 17th, and they're slightly pushing it back. They give us a little bit of time. It's a nice start, but it may not be enough. And when we were talking about this, I realized, you know, gosh, there's so many things that even as a mommy, you know, knowing about what my kids are like for, you know, in a regular school, as opposed to now with this new normal, with the masking, with the physical distancing and all that, I can't imagine what our teachers are facing. And in these discussions that High COVID has had with the teachers, I want the teachers, you know, Kara and Marie, to talk about the stuff that they're going to see. Here is, you know, this is just a minimal summary. And I think, Kara, you were going to address some of these issues for special education, other special circumstances for kids that I didn't even think about when it comes to preparing for the reopening of the school.
I am not a teacher. I just want to put that out there real quick. I've been on a lot of the calls and I've been advocating for teachers, but I'm not a teacher. Yeah. So it's probably better to have Moray speak.
Oh, I was thinking of Piper. All right. So, and you're Holly Hawaii. Got it.
Hawaii, yeah.
Yeah.
Well,
Piper,
I wanted to.
Piper is on. Piper, I know she's on. I saw her comment. So Piper, if you can chime in, just go ahead. It's never too late. And is that her? That's her. Here comes Piper. Well, I was a teacher. I used to be a teacher. I was a teacher for one day. I was a teacher. There was a special program. I used to be on the county council, and they had a special program. HSTA put legislators in the class for a day, and it was a full day with the lesson plan. The teacher gave you the lesson plan in the morning, and they went home. And I did it twice. My first year was with juniors and seniors at Waimea High School. That was hell. And then my second year, the next year, they gave me the kindergarten class. And I can honestly tell you that it made me realize how much we take teachers for granted, number one. But there's no way possible to keep kindergartners, from my experience, away from each other without physically restraining them or I'm just being real, you know. So yes, these government leaders can say, yeah, you know, we can put up a plexiglass board or whatever. The bottom line is kids are going to be kids. Kindergartens, first grade, they're going to be kids. They're going to come off of a period of time that they have been basically away from their friends for months. They're going to come back to school. They don't understand social distancing. And one teacher is going to have a difficult time keeping these kids apart. So that's just my personal experience.
Mel, sorry to interrupt, but that's actually a really good point. When you have to police the kids to not be kids, the impact on them on a daily basis could be considered repeated trauma, reminding them of how abnormal our times are. And so we know how traumatizing the last 3 months when we were sheltering in place. So if you can get into the kids' mind and emotions, and to always be reminded, don't touch each other, don't touch your nose, don't touch your mouth, which is so natural for them. It's a daily reminder of things being not normal. And I posed the question about how healthy is that for the long term. For SPED kids, IEP kids, special needs, having a phase plan and having a majority of kids who can do long distance learning, who can do the distance learning, will actually give enough room for the people that actually need the face-to-face, enough safety to do the face-to-face, enough space to do the face-to-face for the ones that need it the most.
I just wanted to share that we've been trying to get my 9-year-old to wear a mask consistently in practice, so that if he has to do it at school, he'll be ready. And he was heading in to play baseball. He played baseball just this month. They let him play, which was a blessing. And he gets allergies, so he needed to sneeze, and he grabs his mask, lifts it up, and sneezes right towards everybody. I'm like, we've been working on it since March. I mean, that's just gonna happen over and over again.
I know. Piper just joined us, Piper. But I just want to read this comment from a parent, because it's so funny. It says, "Parents, get ready for your kids to return home with a different mask than what you sent them to school with. They will be trading masks with their friends." It's so funny, but it's not, because it's true. It is true. Anyway, Piper, thank you for joining us. We're on the SPED screen. I understand you are going to be speaking on the special ed students. And
I'm sorry I was late in coming. I got home today. I worked all day. I've been working, and I slept through 3 alarms. 3. So I apologize for being late. But I just want to say, in regards to special education, I, a special education teacher, also teach English. And SPIT happens in special education, and it's really important that we know that special education teachers and aides and those working with special education students are going to burn through more PPE. They're going to be more at risk. There's depending on the type of student, we have medically fragile students, kids on the spectrum, the ASD, autism spectrum disorder, and other types of students. There's just going to be more considerations about different types of protective gear. I can't tell you the number of times that I've been spit on as a special education teacher, bitten, drilled on. It's not that these kids are being naughty. It's just that they're just, they have medical issues and or learning disabilities or cognitive disabilities, and they just don't understand. And we need to be there for our students in the capacities that we can. It's really, really important to understand that, social norms are maybe what's understandable for us isn't necessarily understandable for all students. So we need to be understanding about that. Students are going to act out. Students are going to just, students are going to do what they do. And it's our job as professionals to be able to assist these kids, these students with what they need. And just in knowing that we're going to have instances where we're just exposed more because of the very nature of the job that we're doing. That said, not everybody is a trained medical physician. Not everybody is a trained medical provider. And, special education teachers have more training about different things. However, still not trained medical professionals. So I think that it's really important to put it in that perspective. We don't have the medical training just because we are teachers who want to work with an at-risk population and feel called to work with at-risk students. Doesn't mean that we should be so really just right on the front burner kind of thing. So I just wanted to say that it's an important consideration. And these kids need our help. But teachers need assistance. Teachers need extra training. We need it. We're already asked to do Herculean kind of things for our students, and we're willing to do that. But we need some assistance. We need help. Anyway, so it's my 2 cents.
Piper, a couple of questions. Number one, are you in Hilo?
I'm in Hilo. Can you hear the Koki frogs?
Yeah, it's so therapeutic. The second question is, you want to just real quick introduce yourself and let everybody know what you do. And,
sure. My name is Piper Selden. I hold 2 master's degrees in composition and creative writing. I have worked with students from middle school all the way up to college and university. I taught at UH Hilo, UH Manoa, Hawaii Community College. I'm at Waikea High School right now. Anyway, I worked with special needs students. My own son is ASD on the ASD spectrum. Worked with him all through his school, and my daughter's a cancer survivor. So I had a student with an IEP who was a child, and my daughter had a 504. She was medically challenged. So I'm not just a provider and an educator, but also a parent. I can speak to both sides. So.
Thank you. All right. I heard the Radford High School, and I know you touched on this earlier. The principal's on the news last night, and he said that he was very thankful that we had this extra 2 weeks because, and he said exactly what y'all mentioned about the training, that in fact this would give them more time to train the teachers, train the room cleaners, train the aides. Some of you mentioned the third-party vendors that come into the school. How are we going to get all of these people trained? Do we have enough time in 2 weeks to get everybody trained to the point where our teachers will be safe and our kids will be safe? And anyone can chime in. I'm concerned. And trust me, I'm no expert in this field, but it just doesn't seem, knowing how the government works and how long it takes to train, getting the right people in to train. Number one, this stuff, you cannot just go get a lesson plan from online and expect someone to train. It's got to be done by certified trained personnel. Do any of you believe that the 2 weeks is going to be enough, or do we need more time?
Well, I just think the distance learning alone.
Murray.
Just the distance learning alone is going to take more time than that. And then as far as the health kind of training, I mean, they're just coming up with this idea now to have health training. So like, how are they going to throw that together? I mean, third quarter, we were just abruptly cut off, and then fourth quarter was just slapped together whatever we could do, because We didn't even have like equipment at our home necessarily. There's teachers I know in the Big Island here that have no internet access at their home.
Right.
So like, but we weren't allowed to come back on campus. So, I mean, I just wanted to speak though to the social part and the trauma. I really like that point that, you know, schools are not going to be exactly the same. It's going to be all about no, don't, stop. And some of these kids have been through trauma already. Like their parents are losing their jobs. They may not have enough food to eat. I mean, it's gotten worse. It may even be like people that never had that situation all of a sudden have it for the first time. And then with the abuse thing, I mean, I want to counter argument that idea because some of my teacher friends, they did the synchronous learning like we're doing here live with their students 4th quarter. I didn't do it, but they said that they got a glimpse into their students' households and they were able to hear what was going on in the background. And they were able to see the dad with the beer and kind of drunk in the background, like, oh, what are you doing? You know? And so, I mean, they got a good glimpse into the child's home, which could be a whole nother way of detecting child abuse or, you know, dysfunctional homes or other things. So like, there's a balance there. There's an argument for and against that there, you know, I mean, it's true. If the kid just disappears off the face of the earth, I mean, I think it's the ones that are going to sign up for homeschool you got to be worried about, because if I was an abuser, I wouldn't want my kid on the radar at all, right? So, I mean, that's a counter argument that we aren't taking into consideration. And we also are not taking into consideration the parent training that is needed.
Yeah.
I was on this call with these amazing women and parents in the healthcare professions, highly educated. And some of them said they couldn't even help their kids navigate the systems that were being thrown at their kids 4th quarter. That was appalling to me. I was like, oh my gosh, you're right. Some of these parents, I mean, I know how hard it is for me to figure out, but like some of these parents, they're not even getting their heads wrapped around like, you know, 9th grade English. And so, and all these education programs. So that has to be addressed. We need to, you know, we need to train the parents as well. And we need to solve the inequity issues. I was under the assumption that Kishimoto was totally working on the inequity issues of internet access and devices. And then there's also the thing is, yes, they purchased 23,000 devices, whatever. They're distributing them out. But I teach acting, I teach speech. Are these devices going to have cameras? Is the bandwidth going to be enough that you can use your camera? I mean, there's so many layers to this reopening. And to think that we were going to have students come on August 4th, to your question, Mel, 2 weeks is not going to be enough, but it buys us some time to show that it's not going to be enough. And we need, and that August 17th hasn't happened yet. Just because 3 unions support it, it has not happened. We need people to call in tomorrow. They got to sign up at least 15 minutes before the meeting, BOE meeting.
Parents
Download the WebEx, and we need parents to get up there and say they support this plan. We need students, parents. They've heard from the teachers. They're tired of hearing.
They know how we feel.
I'm gonna interject. I'm gonna interject real quick because it's you know, we schedule an hour. I'm cool with going longer if you guys are, because we got 225 people watching right now and it's steady. So if you guys are free to stay on and keep this discussion going, you know, Charlie and I are willing. I want to have respect for all of your time as well. So
Go ahead. 2 weeks. I feel that the healthcare organizations and the providers that are recommending for school reopening and giving insufficient time, I want them to look at how long it took to get readiness in the healthcare department, right? We had March, April, June, you know, April, May, June, July. We had so much of that because we had PPE shortages. We had to learn how to decontaminate. We had to order supplies. We had to set up this and that. Now, the teachers are facing the same thing. They have to have PPE. The National Academies of Science, Engineering, and Medicine don't recommend cloth for teachers. They recommend surgical mask and shield. Procuring those things in competition with the rest of the country, that's also, actually, let me point this out more. Each school, not each district, not each state, is told to order for their own PPE, effectively competing against each other, right? Driving up prices because these small entities are competing against each other. It's the same thing that's happening to private physicians and dentists with PPE. Because we have small orders, we can't be on the priority list, and then we effectively are competing against each other until the high COVID group kind of like thought about this, and you're like, no, we have to order in bulk. We have to have a way to order in numbers so that we can do this. Is somebody going to organize that for the schools? Because that's a lot, right? Surgical masks, there's limitations now on how much we can order as physicians. There's like two boxes of gloves per week, 1 box of surgical masks per week. It's like there's limitations to how much you can order. Who's going to help teachers do that just in that one factor of readiness?
Well, and certain positions in a school are going to need more PPE. Special education and ELL, English language learner teachers, are going to need more PPE. When you have a student who does not speak English as a first and sometimes second and or sometimes third language, you need to be able to see the lips and enunciation, and there's going to be, again, spit happens. I'd also like to say that not all educators are being compensated for training. I mean, all of our substitute teachers, even long-term substitute teachers, they don't get that the non-instructional days that happen before a school year. They're not compensated for those to be able to come in and get the training that they need to be able to know how to be safe and effective in a classroom during COVID-19. There's no funding for that. So you have these people who are coming in, really almost kind of blind to this whole situation, saying, okay, well, I want to do good by, little Timmy or little Johnny or whatever, but they don't have any training at all. And they don't have training because they're substitute teachers. So, or different care providers, they don't get the same kind of training days that teachers do. So there's that as well. I mean, there's so many layers to this that have to be considered before somebody just comes on and says, okay, we need to go back to school. Well, yes, we do need to go back to school. Teachers more than anybody want to be in the classroom, believe me, but we want to be in the classroom safely, and we don't want to put anybody at risk. We don't want to put the students at risk. We don't want to put faculty at risk. We don't want to put families at risk. We don't want to put the community at risk. So it's not a bunch of teachers just saying, hey, back to school for X, Y, or Z. There are real concerns here that are not being addressed.
And you want to plan for long-term opening, right? You don't want to keep on opening, because that doesn't offer stability. One of the advantages or benefits of people saying why school is so beneficial, because it offers stability. Well, if you're always opening, closing, depending on the clusters in school, it's not going to be stable. So then you talk about what kind of system structures are you going to have in school. One of the things that's not so stressed in the AAPD, the American Academies of Pediatrics and the National Academies of Science, Engineering, and Medicine guidelines, it's not stressed so much, but one of the important things, and one of the things we have an advantage, is that we have good weather, and using the good weather and having ventilation in place, open classrooms in place, to have a more long-term planning, to have long-term infrastructure in place, so we're not opening and closing. And the most important thing to kind of think about is this question: how disciplined do you think the rest of the US, and how disciplined are we right now in fighting and being free from COVID? we're becoming really lax. And then when you look at to the mainland about that discipline, we know as healthcare providers, this is going to be with us for a long time. And it doesn't have to. We can stamp it out in a few weeks with the right mitigation and full force effort from everybody. But we know as a country, we're not that disciplined. So we have to plan for our habits. We have to plan for our weaknesses. And that means we're going to be fighting this for 2 years. There's already surveys going out. How many people will take the vaccine once it's out? Less than 50%. And if the FDA only requires 50% efficiency in the beginning phase of it, then that's only 25%. That's not herd immunity. So without that discipline, we know that. We know as a country, we don't have that discipline. You have to plan for your habits. You have to plan for that. And giving them 2 weeks to see the long range. And then I think it's insufficient, and it's also very short-sighted to not plan for the infrastructure for longer range or what will be needed.
Yeah, I wanted to chime in because we testified at the Board of Education meeting. I testified on Holly's behalf, and what we said was the BOE and the DOE need to go back to the state and say, you guys need to stop telling us to reinvent entirely how school happens, how learning happens, and telling us to pull off a miracle when the state's not even handling this appropriately. You know, they're planning to reopen and welcome tourism back still September 1st with one test. So we know that if they do that, our case numbers are going to go way up. And, you know, when the school shut down the first time, they said, we want 30 days, I think, with no cases before we have in-person school. And now they seem to just kind of be like, well, let's see how it works with what we have. You know, there's no plan in place. And I love this phased reopening plan that you guys created, because unfortunately, that's what the DOE and the BOE should have been doing in the first place. And it holds the state accountable too, and says, you guys need to get this under control if you want us to have in-person learning, because it isn't right. And it's when there's too much community spread, there's no safe way to have school. I mean, maybe the doctors can disagree or like, you know, come on. But I'm just thinking, if there's hundreds and hundreds of cases per day, how do you safely have in-person school? And if you can't, you know, the Board of Education, the Department of Education, they need to start planning for, we can't have in-person school because the state doesn't have a plan to get the cases lower. And actually their current plan is to let them increase for us to live with it. So unless the state's willing to change the plan and say, we're going to get cases low, we're going to try to get them in the single digits and take the action that's required to do that, which we uniquely have that ability here, I believe. And we have justification for it because Hawaii has multi-generational homes. A lot of these keiki are going home to their kapuna who are taking care of them until their parents get home, because they're, you know, in single parent households where that is their childcare provider. If something happens to that childcare provider, it takes the whole family out at the knees. And, you know, we have more of that than anywhere else. And so, and we are so isolated that if we do have major outbreaks, it's going to affect us, and we're going to have a higher fatality rate than any other state would, because we have less resources to deal with it. And so I just look at everything, and I mean, that's why the state right now, I feel like, is so disjointed. You know, they say one thing, they do another thing. We need to like support, we need to have a plan that will work and it's realistic, and then everybody else can make their plans around that. But I just want to say, Muriel, is that how you say it?
It's Mireille.
Mireille, I'm sorry. You guys have been working on this phase plan, and when I saw you guys publish it, I thought that's exactly how everything should be planned in our state right now. We should be having phases of when do we open up tourism, when we hit this benchmark, you know, like we have to have a safe way to do it, not just an arbitrary date. And the same thing with schools.
I know that Piper's itching to say something, but I just got to piggyback off the childcare issue because yes, teachers are not babysitters, but I just learned something today on a national call with the BATS that parents who have jobs can apply for FMLA. It's a federal law for leave. If you have to take leave because you do not have childcare for your child, under COVID, they can apply for that and get money to stay home with their kid. And I don't think that's been publicized. FMLA, people should be flooding the federal government with that. We're not getting any luck in Congress to get money from the feds. So we have other ways. There's wormholes. I mean, the more I get into this, the more I learn. But I'd like to hand it over to Piper because she had some other things about our 4-phase plan and other things.
I just wanted to say that it's really important to look at the whole population. I mean, we tend to look at, you know, the typical kids and the typical families, and that there is a need for families who are not typical, right? And I'm looking at and thinking about, we had a parent who, you know, was talking about their child. There's a program called it's a fully self-contained classroom that's not an integrated, so those are for like the most extreme students. And we heard this anecdote kind of from this parent, and it was a summer school kind of situation where certain kids need to be in school all the time because there will be regressions otherwise. And this student, you know, just bolted, ran out of the classroom, and it's like the staff didn't know what to do. It's like, do we go out? Do we run after the kid? And it's just like, it just, there's so many things that we need to consider, right? It's like, you know, the kid's immediate danger is running out of the classroom, you know, putting on the protective gear and running out and like grabbing the kid. And then is it okay to grab the kid? And you know, it's just, there's so many things that we need to consider, not just who's cleaning the bathrooms. I mean, we need training. And the thing of it is, teachers are qualified people. Teachers are learned people. We go to school, we do the thing, but we are not nurses. We don't have triage ability to be able to say, you know, we look after the students when they're in our care to the best of our ability, but there are some things that are just outside our realm of training. And you know, when we're not getting any feedback and assistance from you know, powers that be, it's like, you know, teachers are already willing to step in front of a bullet for a student. All right, we're already down with that. But this is another thing. It's like, help us please. You know, we just want the help.
The governor's press conference today, when he ended towards the end, he said for the people of Hawaii to support the state's reopening of the schools, to support the state's reopening of the economy. Apparently, he has not. His decision is made, and we're going to open up on September 1st. Yep. I know that was his plan. He is not deviating from that. I mean, when this all started months ago, and there was two more things that I really wanted to cover before we go on. But and one is the houseless and homeless community. How we're going to deal with those students, and then what happens when a child comes to school sick, and then in isolation rooms. But I wanted to make this point. When this all started, there was a plan. There was a plan that said, and the governor's plan was, we would not open the economy until we had, I believe, 14 days of continuous drops in the daily numbers.
And where's that happen?
I believe the DOE's plan was 14 days of no cases, 0 cases, if I remember correctly. And I could be wrong, but if I remember correctly, it was, we will not even consider opening the schools until we have 14 consecutive days of no new cases. Now, we are in a period that we have seen record-breaking numbers every day. And yet we have seemed to have, not we, but the administration and the DOE has seemed to have forgotten that original plan, which was, I believe, smart. I think when we can show and prove that our viral load in the state was diminishing to a point where we could safely open our economy and, more importantly, safely open up our schools, then we would move in that direction. Apparently, that's no longer the case. We're seeing triple-digit numbers today, and it's probably going to continue for a while. But we are not. 2 weeks is not enough. I mean, we know that. But I don't know what it's going to take. And I'm hoping that this show will help get, I see a lot of positive comments on the Facebook feed. We got a ton of people. By the time this actually goes out, we'll have thousands of people watch this. And we'll before we leave, we'll put that back on the screen. But houseless community, homeless community, and what happens when a child shows up to school coughing, fever, running nose?
Yeah, and we don't know.
Well, I mean, what do you do? I mean, they obviously need to be sent home or sent to a doctor. What does the school do after that? Do they have an isolation facility that they can keep the kid? Because teachers, you all know, so, and I've been there. I mean, you go to the home health room and you cannot get in touch with your parent. Your parent cannot leave work. We're in a COVID time, pandemic. What do we do? And I don't know if that has been worked out.
And the magical thinking that everything's going to get back to normal, quote unquote, once we send students back to school, that we'll all get back to normal, that the economy will get back to normal. That's magical thinking. It's not going to happen. It won't happen. It's a great idea. I'd love for it to go back to the way it was too. It would be great for it to go back to the way it was too, before all of this happened, but it's magical thinking and it's not going to happen. And so we need a plan. We need a solid plan. And just saying, get the kids back, I mean, I would love to have mornings safe for parents and, be able to have their coffee time and to be able to go back to work. And that would be great. But do we want to do that at the expense of the lives of children? Do we want to put our kids at risk? Because we don't know. There are too many things that we don't know. And so it's scary to me that parents are like, they just need to get off to school. I need to get my morning back. I need to go back to work. Yes, we get that. But at the risk of your child's life, you know what I'm saying? It's a big deal. And people are like, I think people think that we're crazy because we're so passionate about this. And we're so, it has nothing to do with us not wanting to go back to work. We want to go back to work, but we don't want to go back to work at the risk of life. Period. End story.
I just want to put it out that there's so much to think about. There's so many factors to kind of, read about and learn about. I want people to kind of have a structure to how they should think about safety and reopening schools. I want them to know that whatever we do at school, and if the community prevalence is rising or out of control or not well controlled, you don't have safety, right? First and foremost, you have to have safety in the environment, in the ecosystem you're providing. Because whether you're 3 feet or 6 feet, whether you're wearing a surgical mask versus a cloth mask, if there's a lot of kids in school bringing that on, like we said, it's hard to control kids. The schools will be super spreaders. They'll be the clusters, right? And you don't want that to happen. So if you want the ecosystem for safety to work, to have the community prevalence low, you have to put to task the city, the governments, and say, how is your infrastructure to containing an infectious communicable disease? All right, there's been proven stuff around the world, examples of this, and it's to the basic things. Testing, testing, testing. Secure your test. Contact tracing. We know from the experience of Boston, they had 750 contact tracers trained by Paul Farmer, an incredible doctor, and with a population of over 600,000, given there's different densities there and they have different SPED, they still were not able to kind of have enough contact tracers for that. And the number that we have to reach is about 400 to 500. And we're getting overwhelmed. The contact tracing part is getting overwhelmed. Other countries have looked to technology to help with that. How are we doing that here? And we can't, as a community, we have to embrace technology and provide for privacy, right? So there's privacy protective apps that's been developed and that can help us. So we as a community have to be gathering around that, control that technology, make it community driven if it's not being embraced by the city and the governments. Then the third thing that has worked, and we know it has worked because you see it everywhere where they have low prevalence, is isolation and quarantine of travelers who bring it in, COVID positive people. And if we get disciplined in these three things, that is our freedom from COVID. Discipline, responsibility to hit these three things right on, to provide for the community ecosystem of safety. And then we can work at the nuances of, we could fight out the details, right? 3 feet versus 4 feet versus 6 feet. Those things won't matter much. It will matter a little if the community prevalence is low. So I want the people who are watching, and I want people in the community to really put to task the cities and our government to be like, what is your solid plan? Now that testing is, there's a surge in the mainland and we have to compete. How much of the CARES money are you going to put for testing to secure that supply for us? What are you going to do for contact tracing? Having the Governor Ige put out a Facebook announcement saying that if you were at the 808 bar, this restaurant, please get tested, is not the most efficient way. One, because it's not protecting the businesses, because those businesses are not going to get customers for 3 to 6 months because they're known to be COVID clusters, when they could have cleaned up the restaurant in 72 hours and be back to business. There's ways to notify people because technology allows for that without outing any businesses, without outing any persons. In the community, you see Facebook with rumors and people outing themselves and wanting to tell the community, trying to be responsible. But technology can offer those things in a very private way, but we can still have responsibility to each other, and that's possible. And then the important thing that I don't know why they're so resistant, identify a few hotels in each of the island to be quarantine places and isolation places. And then you have freedom in your community. We've seen that in other places that have done this. Like, what is the resistance? Is it no hotels want to volunteer? That's not true, because we've canvassed as a high COVID group. We've canvassed hotels in the areas, and there are hotels that are willing to do that as their community service because they're trying to be responsible to get to freedom. So our road for our road from COVID freedom is wrought with discipline and responsibility. And each of us will have to put them to task as public servants to do that. And if they muffle anything and say, oh, we have enough tests, we have 405,000, show us details. Yeah. Have a plan, give us a white paper, get it out to the public, show us your plan. And then they may get criticized, but you have something concrete. Because right now, the distrust for authority all over the United States is so low that even if a vaccine comes out to help us all out of this, less than 50% of people will take it. And so to have greater trust, they have to have more concrete plans, and they have to put the money where their mouth is. Like, they have to put
I
on.
agree.
Let me just say
If I
real
could
quick.
just-
Let me just jump in real quick because for 4 months we've been doing this show. For 4 months we've had people from South Korea. We've had models, people come on and share their models with us. We've had the Senate COVID committee on. We've had the Lieutenant Governor on a few times. We've had the International Vaccine Institute's Director General. You may all know him, Dr. Kim, from Jerome Kim, from Honolulu boy, is now in South Korea. We found out that South Korea offered test kits. A contact tracing app that was developed by a local boy in Hawaii that is now in South Korea, completely free, all turned down. The problem we're having right now is you have a governor and an administration that is more concerned about our visitor industry than anything else. And he needs to make sure that we don't want to inconvenience the visitor. We don't want to put up a 2-test 6-day quarantine system in a certified quarantine hotel. We don't want to inconvenience the visitors because God forbid they're not going to come. When this is all over, Hawaii is going to melt away. Tourists not going to come. That's all hogwash. We know that. What is going to take, and I know we're way past our time, but I do want to give each of you an opportunity to say a few words. But more importantly, how can our viewers help in this crusade to get our teachers and our students in a safe place? We've had so many people on, so many brilliant ideas. Charlie and I have beaten this drum so many times that it actually gets frustrating at times. And I haven't heard Charlie all night, but trust me, Charlie lost his brother to COVID early on in New York. He was one of the early casualties of COVID. He has taken this personal, and we have tried our best to get the message across to the governor, lieutenant governor, and everyone else.
Well, you gotta be honest with them, Mel. Just when we brought General Hara on, right? The very next day he got removed. So I don't know if it's a good thing or a bad thing when people come on our show.
Yeah, we have had the blessing of having these guys come up and speak freely. And yeah, I mean, some of them have paid some consequences, but it's important we get the right information out and let the public know. And I can tell you that and I'm trying to, when I'm looking down, I'm looking at the comments, but I haven't come across a negative comment yet. And as far as this discussion, it's all supportive. And I really want to get some value out of this and not just blah, 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 but what can we do? And I know we had the screen up earlier, but let's just go around the table one more time.
Can I just say one thing real fast to the panelists? Mel and I were both retired police officers, investigators. I'm from the beautiful, I retired from Maui Police Department. So Maui, no Kauai. But the thing that we've always been worried about has always been the safety. There's certain things, there's certain aspects that we know, because when we're looking at the kids going back to school, I've never heard once anyone come in and say, hey, are we going to test the airflow of a classroom? Because you talk about restaurants, they tell you where to sit, where not to sit because of the AC system. Have you done that for the classroom?
No.
The other thing that we talk about is, what about the school resources officer for those classes that's going to change during the day? Will you have somebody out there that's going to actually tell the kids, hey, keep your distance? Because they're going to clump together at one time. The other phase to it is, who is going to do some type of decon training? Because if these kids are resilient, like they say they are, then what that tells me is these kids are asymptomatic. They're going to take this home because right now, the clusters we have in Honolulu is with Pacific Islanders. All the kids like to get together. They don't care about washing their hands. They go home. Guess what happened? Grandma and grandpa get sick. So all of these kind of stuff need to be addressed right away, because if they don't get sick, they'll get somebody else sick. Because why? They're not going to show the symptoms. We've seen that. We've heard that from the experts. And these are the things, Dr. Yan, you talked about stopping that community spread. That spread can be innocently spread from the young kids. And it can be beyond a super spreader. That we know. Because all you take is you take a classroom of 10 and you just do that multiplier effect, and then you'll see what happens from that point.
And I want to highlight that for for Hawaii, this is personal. This is not just about statistics, but if you look at the statistics in the Northwest, in the East Coast, in the Northwest, it's Pacific Islander Hawaiians that are disproportionately affected based on their population in those areas with severe disease and death. In the East Coast, it's people of color who are disproportionately affected. Social factors play into that, genetics. But if you look at our population, a lot of us have hypertension, hyperlipidemia, all these different obesity, all these different things is not something that is gonna pass by our population and we'll be okay. We're talking about 30 to 40 people have hypertension here, risk factors for severe disease and death in this COVID disease. So it is personal. It's very personal. We can't just look at statistics. It is the people we're living with that are going to be affected. And to say that, to lead with, we're going to have infections and we have to accept it. In the healthcare world, I'm a surgeon. So if I lead with that, I'm going to have complications, but for the most part, it's small, it's 0.02. You don't lead with that. You plan to perfection. You plan to do your best to have the least complications. And then you talk about all the different statistics, but you don't lead with, we're going to have complications, we're going to have infection. I hear a lot of our leaders leading with that. And I'm not comfortable with that kind of thinking. And we all shouldn't be, because we have a higher percentage of our population that are Native Hawaiian, Pacific Islander, have hypertension, diabetes, all those things. And so we as a community, like I said, the idea of margin of error is different from other communities. And we have to plan for it.
Let me tackle you with this thought then. You know, one of the biggest advocates for schools has always been Senator Kurt Favela, because he's going to tell it like it is. Okay, there's no sugarcoating. If the F word flies out, so be it. But he's getting the point across. I think for your cause, and you know, Mel and I have always been one that, you know, we don't take sides. We bring the information onto the show, so you get the information out to the viewers. It's got to get the viewers to understand where your plight is, where you want to go with this. And a lot of it is, number one, we've always said from day one, our biggest challenge has always been the Attorney General. For some reason, you know, sometimes you just got to take a chance. And if somebody challenges in court, so be it. But you won't know until you take that chance. So every time what you've all been talking about tonight, you get to that door, you know, the accountability of our elected officials, it gets stopped. It doesn't go that extra mile. So I think what your viewers need to see is, hey, not only getting to the BOE for tomorrow's meeting, they got to get to the representatives and they got to put pressure. And that's what Eva Beach as a community, that's what they did. They went sick Favela on them. And that's why he's always in the front pushing hard. But he's only one. Maui, you've got Kalani English, you've got Ross Baker. Who else you have? You know, you got Agaran, you got all of them. Your local council people, they all got to get on board. I know Mike Victorino, he's one that he's now kind of wondering, hey, what the heck is going to be going on? You know, that's somebody that you folks got to talk to, and they got to push it from all different angles, because the governor ultimately will meet with all the mayors and they got to come to some consensus. I know our mayor, because his wife is a school teacher, they're very passionate and they're very worried about the dangers. So, but that's just one mayor, one county. I think you folks got to do it. Big Island, you're on tonight. Big Island, you got to do that too. It has to be a concerted effort that comes in from all angles. The single approach is not going to work anymore. That's what we've been noticing for the last 4 months. It doesn't work. And I'm not saying it to discourage anybody. I'm saying it hopefully that it's going to kick some Okoli into gear and says, you know what, this is the route we got to go. We got to take.
So I wanted to put out there with Hale Hawaii, we are trying to push this hashtag. It's just a hashtag. You can write it on your car, but protect Hawaii, you know, from COVID-19. We're telling the governor, protect Hawaii. We want people to like be putting on Facebook, because when we poll people, what we're seeing is 80% of people who live in Hawaii want our governor, they want our representatives to protect us. So we want people to do that. We want people to write to the governor, write to the representatives. That's what we've been asking them to do. We're pushing a petition. We've been trying to advocate for teachers and other stuff, but everyone has to. And the thing is, most people feel the same way. And so we just need to mobilize and put that pressure out there. And, you know, maybe public demonstrations aren't the answer right now, but we can publicly demonstrate in our car safely. You know what, we have to get creative, and we're going to be thinking of ways to get creative, but we have to demand that our government protect us. And there's a group of doctors, I don't know if you guys have already had them on your show, in Kauai, who came up with this amazing petition. We actually are pushing it above the petition that we originally made. We said, scrap that, even though it had 2,000 signatures. And now we're trying to push theirs because it's better. And, you know, you test before you come, then you quarantine in a quarantine facility for 6 days, and then you take a second test. And what we've heard is, you know, we've gotten feedback that's not realistic, or there's not enough testing. Well, if there's not enough testing, we shouldn't be having visitors. If we don't have enough testing to test every visitor when they get here, then we have no business inviting tourism right now. And we need to tell our governor that. But I am encouraged. I talked with one of the doctors who helped make that petition, and the governor is meeting with them on Monday. So hopefully that's productive. But we have to all keep putting pressure, because we're all wanting the same thing. You know, we all want community spread to be gone, and it's possible. We just have to demand it, because there's big money pushing the other way.
Which group of doctors are you referring to, ma'am?
It's a group in Kauai. They put together a petition.
Is that Dr. Evelyn and Dr. Who's that, Mel?
That was the group. Yeah, that was a Kauai COVID discussion group. We actually had them on our show. We had all of the doctors. We actually got them to see the lieutenant governor had a meeting. It did not go well. It was not well received. I'm happy to hear that the governor is going to talk to them, but that is exactly what we need. That is exactly what this state, considering the other options, that is what we need. And I know we got some
Evelyn Schwartz, Dr. Monty Downs, and Dr. Heidi Hellisland, and Dr. Paul Asaki, family practitioner. And I think Dr. Hellisland is an infectious disease specialist.
Yeah, so we had the author from Washington State. He was here. We had Dr. Alderetti, who's a specialist. And anyway, we had them on, and it was fascinating. And you know, it's, again, the governor knows how the people feel. He knows. He reads social media just like everybody else, or he has people that does. I posted on the Facebook feed. I posted from Piper. Thank you. I cut and paste exactly what you sent me in the chat. There's the address for all of you to email your support for our teachers and our students, for their safety. The BOE meets tomorrow at 1 o'clock. So we need to get those emails out tonight. We need to get it out tonight. Doesn't have to be very long.
Well, actually, the deadline for written testimonies passed, but they will accept late testimonies, just that it won't be put in front of the board before they vote on these things.
Yeah.
And what we really need is oral testimony, and you need to allow some time, because you have to download the WebEx. You also will not receive a link. You literally just come on to the meeting through WebEx, and after, you have to register to testify at least 15 minutes before the meeting. There's a link on their website, but then there's no link that will come to you. You know what I mean? So you have to, and we need parents, we need students, we need 25 parents in a row saying, we want this 4-phase plan. That's the first step. The August 16th, we're gonna have to handle later, because I don't know, they're just stuck on August 16th. We got to get rid of these dates and start going criteria-based, benchmark-based. Arbitrary dates don't work in COVID era. They just don't. I would like to see at least some hand washing facilities on campuses. Do you realize we don't even have enough sinks? It's not the soap. We don't have enough sinks to even wash the hands for 20 seconds of all the children. It's
During
going
the
to take
passing time.
hours,
During the
hours
passing-
upon hours for each child to do that. And I'm concerned about the overuse of hand sanitizer. How healthy is that over time? I'd like to hear from the health professionals on that in the future. And they're still going to start sports August 19th. I just can't believe it. Marching band, August 19th.
Yeah.
We've got to get away from these dates and to have the criteria. And I'm sorry, please go to hawaiisafereturn.org, hawaiisafereturn.org. We give explicit directions on how to testify for tomorrow, and we will continue to have actions. We had 2 town halls. We had 55 actions we came up with in the 2 town halls. We have plenty of ideas of actions. So if you want to get in on the resistance and the pressure to, resistance against the insanity and the pressure to do the right thing, please come to our Facebook page, Hawaii for a Safe Return to Schools. And if you're not on Facebook, I know some people are allergic, just go to our website. Our website is hawaiisafereturn.org. And I really thank you for this time.
Audio. What happened?
Yeah.
Dr. Gupta? You have
Hi.
been patiently quiet over there. I'm gonna give all of you an
Yes.
opportunity to speak before we call it a night, because we do have a lot of people still on. So what are your
Sure.
thoughts? I'm gonna start with you because you have
Sure. So, I'm a dentist. I'm not a teacher, but I've heard a lot from teachers tonight and previously. And the one thing I've noticed is that all of this discussion is reminiscent to why we started our healthcare provider group, the high COVID, now called high COVID group. What was happening back in March was that all of the providers, the nurses, the healthcare employees, we're just getting really nervous. We're all scared about the unknown. And it was just a scary time for many of the providers. I won't say all. And we got this group together to become a unified voice across the state of Hawaii, unifying healthcare providers, nurses, workers across all the islands, gathering letters and gathering over 1,000 signatures on one of the letters asking for the hospitals to hear the voices of their employees and their providers. And they did. And having a unified voice very much helped turn that around. And the hospitals responded to it. And I'm now on the board or the committee, the Emergency Operation Committee with Maui Memorial Medical Center. And they've done a fantastic job turning everything around by forming this committee. I sit on it as a community liaison, so I'm able to report back the community provider feelings about what's going on directly to the hospital CEO and the leaders of the hospital. So having these grassroots organizations really work. And like I said, the one thing that Maui Memorial did well was they listened to their providers. If your workers, your employees do not feel safe, then there needs to be an open discussion about how to move forward. So I'm very hopeful for the teacher and the parent community that there can be an open discussion and you can proceed safely. And I really admire the phased plan that you created. The second quick thing that I wanted to mention was I've been working with Katie Folio from Hi-Fi, who's been a big advocate of the temporary smoking ban. That's regarding the secondhand smoke exposure for all of our kupuna, our keiki, all of us in the islands and multi-unit housing complexes. And I, as a dentist, have had increasing reports from parents that their children are affected by secondhand smoke because of their neighbors smoking at home and working from home now. So this is affecting our children and all of us on the islands. And I think it's important to take it seriously. Also, smoking is related to COVID-19, and there have been studies reported that show the effects of smoking on the risk of COVID-19, heightening the risk of COVID-19. So I think it's really important to take this smoking concern seriously. You can discuss the matter with Hi-Fi. They have a survey going around right now. So I'd encourage everybody to fill out the survey and just advocate for this temporary ban on smoking so that we can keep our community safe. There is currently a federal mandate for no smoking and multi-unit housing for public housing, but we would need something more involved to create something for our community for all housing. So thank you so much, Mel and Charlie. I really appreciate what you're doing for us and our community.
Yes.
Thank you. All right. Kara, why don't we?
Well,
You know, I had some there's a lot of emails and websites being posted from different supporters of different organizations, and so if you could, you know, is there a general website that people can go to get all of the information? Is it COVID Hawaii or COVIDHI.org?
Yeah, ours is Hale Hawaii, Hale like house, halehawaii.cc, C like cat. So halehawaii.cc, and then I can link you guys' website, y'all's website on there too. I'll add it as soon as we finish this call. That way people can find all of us in one place real fast. Yeah.
Thank you. Dr. Lisa.
Well, I don't have much more to add than all that these lovely ladies have already talked about. I'd like to defer my time to them, but just thank you very much. Mahalo for doing this and for giving us a chance to reach out to our community. I think, as we all know, the more that everybody knows, they can participate, they can send their emails, they can let their voice be heard. And we so much appreciate your show and letting us talk about these issues that are important.
Well, thank you. I know you folks are all busy. We appreciate. Mireille.
I was browsing through the testimony that's been posted so far for the Board of Education, and I saw a few parents saying they want their kids back in school. I've already decided on an action I'm going to do personally over the weekend. They have their emails posted there, and so I'm going to link this YouTube show to those email addresses. I'm going to personally email them and say, watch this show and see if you change your mind. Thank you again.
Yeah, I will put this up on YouTube tonight, so it should be up in about an hour. It'll be up there. So just go to my YouTube channel and you can get the share link from there.
And I mean, seriously, that's how we've grown the group. I mean, I have been mining names from press conferences of people of like mind, and I said, hey, you want to join our page? We're doing this. We're doing something about it. We're not just complaining. We're doing something.
So you remind them to subscribe to my channel now.
I know. I just discovered you and I love it. I watched the Favela show on Monday and I just love that guy. He and I have talked since all of this happened, and he's on our page and he's participating. So we really
subscribe button, right?
we really appreciate Favela. He's awesome. And we've got Amy Peruso's on board. She was at our town hall. We have Kai Kahele's on active duty right now. He's my senator, and he wrote a letter of support. His aide called me and talked to me for a good half hour, getting tips. And we have plenty of ideas. There's just not enough time ever to talk about it.
Say to the highcovid.org group is really amazing, and that's a really interesting kind of collaboration between medical professionals and teachers. And they have Zoom calls Mondays, Wednesdays, and Fridays at 6:30. So if you go to their site, you can, they've got the link that's just right there. I think there are so many concerns. Another big concern that we didn't even talk about was teacher to teacher transmission and how scary that's going to be. I mean, the one kind of common denominator is going to be teachers. And if a teacher is infected, that's a whole lot of kids that are cycling through that. I wanted to say thank you so much for helping to bring this to a wider audience. I'm sorry that I came in late. We activists and Mireille and I were talking earlier, it's exhausting work. And we're working to try to prepare for the upcoming school year, you know, Mireille and I were at school all day today, and then we came home and we've just been go, 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 go. And I'm completely exhausted, but it's important. Lives are at risk here. So I just want to say it's important. Ventilation's important. Teachers are important. Students are important. You know, so thank you so much for having us on tonight, Mel and Charlie. And this just, it's really an important thing. And I just really appreciate you taking the time to have us be able to highlight this for everyone. And again, it's Hawaii for Safe Return to Schools on Facebook. And we do also have a website. So please look out. We really need parents to speak up. You please use your voice. The superintendent really thinks that parents just all want their kids to go back to school. So please speak up, use your voice. This is your turn. This is your time.
Thank you. And we have, you know, Charlie and I, we're the yin and the yang. And tonight we have the yan. So we get the yin, the yang, and the yan.
Yeah.
I think I'd like to leave a message. My last thing I want to say is that full court press. Don't let up. If they have an answer, keep asking the questions. And even before COVID, there's things that were ready to erupt in Hawaii, right? Things that were ready to change. And so you can kind of see this crisis as in Chinese, there's a character for crisis has two components to it, danger and opportunity. Don't just take the danger, take the opportunity. And like lava that's erupting, you can take old beaten paths, or you can also make your own, building up the community paths, the community solutions. So building up the community to create your own solutions so you don't have to wait for anybody to come up with them. And the 4-phase plan is a community-driven plan made by the teachers, and it's viable. It's proven by the Department of Education in Milwaukee. Massachusetts is doing something similar because it gives people time to respond to community factors. Having distance learning stamp out and having training for that and having resources for that will allow you to respond in the safest way for our teachers and our kids in our community, right? So full court press. If somebody comes up with an answer, keep pressing with questions, more questions. You don't have to have answers, just more questions. But it's great to come together as a community to provide that answer for the whole community.
Thank you so much. Charles.
Yes, sir. Yes, sir. Yes, sir.
This is where sometimes, like last night, we all ended up with a sore belly from laughing so hard. I'm going to see how he ends tonight, Charles.
Well, I'm going to be polite. We have a lot of lovely ladies on, so we're not going to go way north or way south on this one. You know, first of all, I'd like to tell the viewers, thank you so much for joining us. Thank you to this group that's been assembled here to talk about this issue. You know, we tried to get Corey Rosenlee on with us. I talked to Kyoki Kerr. He and I worked together when I was at the medical examiner's office, and I know Corey is very, very busy. But, you know, I applaud the group, and I'm sure the viewers does the same. You know, by the time this thing airs tomorrow on a replay, we've already gotten up to close to about 4,000 viewership. So that's how the thing goes viral. So it's just as long that they can tag in on that. But the things that I did want to cover real fast with the group, you know, Mel and I, we've been hit straight on, blindsided, whacked from the back when it came to HIPAA. Everything was about HIPAA. Mel used to bring up the fact that, hey, when you get a shock attack, they tell you what beach the person was attacked at. They tell you where the shock is at, you know, and what time. Because we always said that if you get an infection, it would be good. We don't need to know anybody's name. We just need to know the location so we can match up if we were there about the same time. So if we start getting symptoms, they said, oh, I think we better go in because there's a likelihood we might have gotten tagged, okay? That was 4 months ago. They told us it's irrelevant, it's not gonna work. What's happening now, right? So that's proof that if you keep on working on these guys, it's gonna change. So now what does Anderson do? He's calling for help. I need help. Who was at these bars? And they call them straight out. Before, they would never do that. But that's what we said, hey, you got to start doing that. The other thing was Mel predicted that these numbers are going to climb above 100 to 100. He thought it was going to be this weekend, but today it hit because we watch these numbers so closely and we watch how the thing, because all of you know Dr. Miskovich and we have him on all the time. And because he's the premier now expert of testing, he knows, especially when we brought on South Korea, what's the missing link? We had asked him. And he said, the missing link is this: the state did not jump on the opportunity to get the test kits. They went with one provider. That provider, because Hawaii was only ordering so much, that provider went with the big guns, like New York City, like California, who were ordering by hundreds of thousands, right? So they said, you know, in Hawaii, you got to wait on the side a little while. Okay. We always say, hey, why not go back and ask them? Because why? We had South Korea on. The liaison that used to be head of economic development for city and county of Honolulu is now the liaison for the South Korean government. She can make that happen. Why this state hasn't jumped on the opportunity, nobody knows why. The last thing, contact tracing. How do you contact trace when you got little kids involved? They're going to be intimidated right from the get-go when they see an adult says, you know, we need to talk to you. Mel and I have always recommended, hey, why don't you use retired police officers who has investigative background? Because I'm going to tell you right now, these clusters that we experience here on Kauai, Pacific Islanders, they don't like to talk to authority. That's why they won't give you information. You got to be able to shake that tree to get something out of them. I can bet you the contact tracers that's in place right now will go as far as, okay, how you feeling today? You want to talk to me? They're only going to give you the name of the person that they know was in front of them. What about talking about, hey, I know there's about 4 or 5 people behind me. If you talk to them enough, he says, hey, you know what? They came with a friend that I know. Let me go ask that friend and they can give you the name of who that person is. That's how you start branching off the tree in the tracing. Do you think they do that now? No, they don't. We know that for a fact. So what you folks are doing, what you folks are getting out, I applaud you folks. And I hope and pray that the viewership, because we see some new names that we haven't seen before, that it's probably with your group and they can get the message out, continue to get the message out. So thank you very, very much. Melvin?
Thank you, Charles. Thank you very much. And ladies, thank you for your time. Thank you for your information. You know, it was always our theme to inform and educate. We had no idea what you guys were going to say. We didn't know if you guys were going to come up here and crash our theories or our positions, and you didn't. I mean, we were on exactly the same page. I did want to, you know, everybody has one of these. Everybody has, and I've done this so many times, but everybody has, you have a phone. You may already know this, but try go to your settings. All of you watching, you can do this. Go to your settings. If you have an iPhone, I don't know if you have an Android. Go to settings and then go to privacy. And then go to health. You see that?
Scary.
You guys all see that? That is an app that is installed on everybody's smartphone, that if the state was to request permission to use the API, every one of us with a smartphone has the ability to be in a contact tracing program, an app. That's there. It's free. We just got to get permission. They have not done that. I mentioned earlier, South Korea has offered a contact tracing app, which would be a QR code reader. That's it. When you go into like the bar, a bar, before you can gain access, you scan the QR code. It automatically transmits your phone information, basically your phone number. If a positive is found that went to that bar, the Department of Health gets all of the phone numbers. There's no guessing. There is absolutely zero guessing. They know every single phone number that was in that bar in that period of time that the person that was infected went to that bar, the restaurant, the supermarket, wherever. That was offered to this state by South Korea for free, and we declined it. So the question is why? I don't know. The question is why are we so not following the organizations, the countries, the states, the cities that is having some success? I don't know. Somebody mentioned about the date specific actions or activities. we know that COVID-19 doesn't work on a timeline. It just happens. It cannot be based on dates. It has to be based on benchmarks. We know that all the experts have told us that on this show. Everybody across the stinking world says that, except the state of Hawaii. We're going to set a date and we're going to force the opening to meet the deadline. We know that the school's not going to open August 17th. I can only pray that Governor Ige wakes up and realizes what he's doing.
Kishimoto.
But we can only pray and hope. So thank you all again. I appreciate it. That was my rant for the night because I share all of your frustrations. I share all your fears. You know, my kids are old already. They're not going to school, but I got a lot of family and friends that do have kids. So and a lot of family and friends that have teachers. Yes.
Maybe you can invite me with the tech lead for Sustain Hawaii next time, because we put together nonprofits in Hawaii. We built on the open source app from Harvard and MIT called Safe Paths, and we enhanced it with stuff we need for Hawaii. And Sustain Hawaii has been leading that, and we have the solutions available there. We've presented it to the Senate. They like it. The Senate Committee on COVID, they liked it. We've had opportunities to present it to the Department of Health. They like the diary portion of the app, but they're not willing to let people self-redact and immediate notification when somebody volunteers their location information. And we don't know why, but we're not willing to give up that technology because as the community, we're ready to launch with it for a couple of weeks. And it has privacy protection in it. It addresses the needs we need for the tourists. So I don't want to take more of people's time, but that app is ready to launch here in Hawaii, and we need a lot of community support because everything's going to be voluntary. And since we don't have the Department of Health and the state with us on that, we'll have to roll it out as a community-driven program. By the way, the state did apply to get the API. They're just not willing to use it yet.
And they should.
Yeah.
I agree.
Well, we'll definitely be happy to bring you back on with the new technology and share that as well. My email is very simple, melraposo@gmail.com. Can I get that wrong? Mel, no dots, no capitals, just melraposo@gmail.com. We definitely would love to have you guys back on. So with that, y'all, best of luck. All of you viewers tonight, right now, hit the emails, get the emails out, register to testify tomorrow at the hearing, and let's make some changes. Let's make it safe for our teachers and our kids and our employees of the school system. With that, y'all, take care. God bless. We love you guys. We'll see you guys tomorrow night. Dr. Trubkovsky from the Doctors of Waikiki will be joining us at 7 o'clock tomorrow night. That is always entertaining. You guys take care. God bless. See you guys tomorrow. Aloha.